It affects their relationship with their family because in all likelihood their siblings are getting pregnant. And if their siblings are getting pregnant, it means their parents are becoming grandparents. And one of the most painful things I've seen in my patients is for a younger sister to produce the first grandchild. And that just sends my patients off. I mean, it's incredibly painful because, of course, the parents are ecstatic about becoming grandparents, leaving the infertile couple just out of the loop, disappointed, sad. And, you know, a lot of times families are not sensitive. You know, the new grandparents just can't stop talking about the grandchildren, the siblings. You know, a lot of the problem with siblings is you might think that sibling rivalry is dead. Not. You know, the sibling rivalry does raise its ugly head once again with infertility. It can also affect a couple's relationship with their friends because in all likelihood, all their friends are having kids. And so, you know, the woman may feel like all her friends' lives revolve around babies and children and preschool and carpools, and she's left out. And so at a time where she might be experiencing the worst crisis of her life, she's lost her friends, and maybe she's lost her mother, and maybe she's lost her sister in terms of people able to provide support for her. It can also affect her job. I mean, one thing about infertility is you can avoid pregnant friends and pregnant neighbors and pregnant family members if you want, but you can't get away from pregnant coworkers. And especially with our nation's cubicle system, it's very painful. I have a patient right now who works in a cubicle setting. There's a woman in her company who's pregnant who every day visits one of my patient's coworkers whose wife is pregnant. And they talk about the pregnancy and all the symptoms of pregnancy and buying, you know, cribs and strollers, and my patient's going crazy. But she can't not work. And so, you know, she can't escape this. The other thing is that infertility treatment also involves coming to the hospital or clinic early in the morning for a blood work and ultrasound, which means you're late for work every day. If you have an insemination scheduled tomorrow at 2 o'clock, you have to be there at 2 o'clock, whether or not you have a big client presentation. So it can interfere with work. You know, a lot of patients are embarrassed to tell their boss. And so, you know, they might put their job in jeopardy because they're late for work or they're absent so much. Or the boss may think they're looking for another job because they're away so much. One of the problems with infertility is a lot of women who have known forever that they want children choose careers that are compatible. You know, they became a nursery school teacher or they became a nurse or a teacher, whatever, a career they knew could have some flexibility to involve children. I also have a lot of patients who are in jobs that make infertility all the more painful. I mean, I have patients who are obstetricians or labor and delivery room nurses or nurse midwives or pediatricians or, you know, daycare teachers. And all day long, they see women complain about being pregnant or women complain about their kids. And it's like a knife in their chest. You know, they can't get away from it. And you can't switch careers all of a sudden, especially during infertility. You don't want to switch careers, but it makes it, you can't get away from it. It makes it so much more painful. And, you know, what do you do if you have a job that involves a lot of travel? I mean, you can't travel during a lot of this treatment. And so I've had patients who've had to say to their bosses, look, you know, I can't travel. I have a medical condition. I had a patient once who lost a lot of time from work because of infertility, didn't tell her boss, who thought she had AIDS. Because it was the only thing he could think of that would require that much time at the doctor's office that she wasn't willing to talk about. And so sometimes it may be better to tell, you know, your immediate supervisor what's going on rather than have them wonder, you know, what is it that you're doing? You know, that could backfire because they might be extremely Catholic or they might think, oh my God, as soon as she gets pregnant, she's going to quit. But for some people, honesty might actually help you. I've had a lot of patients who can afford to quit. You know, they feel like infertility is a full-time job and they just couldn't keep their job, either because the job itself was too painful, like being an obstetrician, or because the travel just made it incompatible with infertility. If you can afford it, which a lot of people can't, if you can afford it and you want to quit, the only thing I'd caution you about is don't just sit at home. I mean, the last thing in the world I would want to see is somebody basically sitting at home watching their follicles grow. Then you just become an infertility patient. And so if you decide to quit your job, make sure you do volunteer work or remodel your house or something so that you're not just sitting at home thinking about infertility. Don't just become an infertility patient. Yeah, I think one of the biggest myths that my generation was sold, and you know, it sounds idiotic because, you know, I remember from biology class way back when that fertility decreases with age, but women, you know, were told, you know, you can have it all. And it's amazing to me, you know, the American Society of Reproductive Medicine a couple of years ago had this huge national advertising campaign saying fertility does decrease with age. Your time is running out. Don't wait till you're 42 to start trying. And I remember being interviewed by a Newsweek reporter who was doing a big story on that advertising campaign. And I said to her, I have a patient at least once a week who didn't start trying until she was 38, 40, 42, and it never occurred to her that could be a problem. I have a patient now who's in her mid-40s and is in absolute denial because her mother had her when she was, I think, 44, 45. And so, of course, if her mother was fertile at 44, she would be fertile at 44. A lot of women have no choice. They don't get married until they're 38. They don't have the financial stability, whatever it is. It wasn't that they made a decision not to try, but that they didn't have a choice. And, a lot of these women start trying 5 seconds after they get married, which, of course, complicates the relationship. I do see patients that did make that choice, who got married younger and decided for whatever reason to postpone trying, either because they didn't want kids or because they really wanted to travel and sort of get that out of their system, or because their careers precluded having children. And those are the ones, what do I say to them? If somebody was married for 10 years and didn't start trying until she turned 40 and now has infertility, the best I can say is, you made the best decision for yourself at the time. And if someone had said to you when you were 30, you were going to have infertility at 40, she probably wouldn't have waited. But, one of the problems we're seeing is all these celebrities having babies in their late 40s, early 50s. The vast majority of these are egg donor babies. It's no one's business where the eggs came from, but what you don't want to see is, and I've seen this a lot, if a famous celebrity can have a baby at 51, well, I can have a baby at 40, so I'll wait a few more years before we try. And that does a disservice because, in fact, you can't necessarily get pregnant as you get older. On the other hand, if someone is 40 and has been trying and can't get pregnant and has been married for 10 years and is beating themselves up, no one can guarantee they were fertile at 30. I have a lot of patients in their 20s and early 30s who have infertility. So the age in which you try does not guarantee pregnancy. So for a woman who's 40 who's beating herself up that she didn't try earlier, 30 might have been not a whole lot better. I had a Mind Body group about a year ago. Half the patients were under 30. So age is an issue, but it's not the only issue. And this is expensive. The injectable medications literally cost thousands of dollars per cycle. Do you do an IVF cycle, which has a much greater chance of success than a medicated IUI cycle, but is also, $12,000. And you often find couples fighting about how to spend money. The wife may want to do another IVF cycle for $12,000, and the husband may be more concerned about their financial security. And the thing that even I see in Massachusetts, even though we have insurance coverage here, is that couples, finish treatment, they may have run out of money, and then they're facing either egg donation or adoption, which are also tremendously expensive, and they may be depleted financially. And so, do you do another IVF cycle, or do you save that money for adoption or egg donation, which obviously give you a better chance of having a baby? So the money can be a huge issue for couples. And, I've seen couples where they go to family members to borrow or get gifts from their parents. And I actually had a couple where they went to both sets of parents to ask for money for treatment, and one set of parents gave money and the other set did not. And then they got pregnant. And the parents that gave money felt that they should have more access to that baby than the other couple because they helped pay for it. Which, may sound sort of sick, but you can kind of understand how those parents feel. And so then you have this couple who are feeling very conflicted in terms of what do you do in that situation. So money is very hard, and we're not used to in this country having to make medical decisions based on financial factors, and it feels sort of foreign. And so finances can be a really tough part of the whole deal.